Hello, all, although it looks like Anita's on another call.
Good morning.
Good morning. How are you doing?
Okay.
Yeah, what's going on over there?
You know, lots.
Yeah, you have a pretty busy job.
Yeah. And I had another classroom teacher quit today.
You had another what?
Classroom teacher quit today. Because I also do early childhood.
I know. Was that COVID related or not?
No, she took a job at a district. I have to take this call. I'll be right back.
Please go ahead, Anita. Do whatever you need to. Hey, Ruth. Hey, Marion. Hey, Shulamit. Morning, Paul.
Good morning. Good morning. Oh, there I am.
There you
Sorry.
go. How's everybody doing this morning?
Hot.
We're good.
By the air conditioning.
Yeah, we did family photos last night, which I thought was going to be pretty horrible. It wasn't nearly as horrible. We had it planned and our photographer wasn't available for another 6 weeks. So we went through with it and it wasn't so bad.
You did them outside?
Yeah, like 7 o'clock.
Oh, boy.
Ah.
No.
Actually, it wasn't bad at all. I was very worried, obviously, but you know, things happen.
Shulamit, I just edited the video from the program the other day, and Marcia's going to send it out to everyone.
Thank you very much. You know, I had a vested interest in the subject.
Yeah.
Thank you, Marion.
Sure.
Karen, do you know if David is joining today?
I will text him. I told him, he knows we have our meeting today.
Yes, I know. Actually,
I will text him right now.
I know he knows. Ellen, this weekend I made a very large deposit at the resale shop of like 4 suits, 12 suit shirts. I got them all cleaned before I dropped them
Oh,
off.
you're sweet. Thank you.
I know the woman there was very nice. She wanted me to sign some sheets so that you could continue to email me. And I kind of said no, and she wouldn't let me not say no. So I walked over to the table, and when somebody else started dropping off stuff, I just walked away. I think
That's
you know
okay.
how to find me.
That's all right. We know where to find you. It's all right.
I know.
Ellen, you're not taking books, are you?
We don't really take them just because we tell people to donate them to the J for the used book sale.
Right, and that's
They get way more money for them than we can.
okay. Everybody's backlogged books, I know.
Shulamit, I used to work at the Library Foundation in Minneapolis, and we actually had a used bookstore. And our problem was that we got so many books given to us that were nobody wanted. Worthless is not a good word because I think all books are important. But we had an entire storage room of books that like nobody would buy and stuff.
Right. David, wherever you are, I want to be there. That sky behind you is beautiful. Oh, you're muted.
I'm not very far away from you guys. I am actually in St. Charles. I'm
Oh.
headed down to Cape Girardeau for a meeting. So I'm sorry I'm late. I pulled off, decided to grab a cup of coffee and take it from the coffee shop.
There you go. All right.
No
Well,
worries.
it's the typical 10:02, so it's start time. Good to see everybody. It's been a couple weeks. Hope you're all doing well. I don't have anything specific that I know of, unless someone reminds me that I do. So I don't think we have an agenda big for today, but I'm thinking maybe David's got something because might be a few things going on statewide.
I want to make sure that we take an opportunity. If people don't notice, there is a new face.
Right. My bad.
There is a new face on the screen. Mindy Sharp. At least wave, Mindy. so that people can see which box it is. So I'll say this, that Mindy's the new Don, right? Okay, so Don is moving over to take on the museum role full-time because he was doing that full-time and the COO at the Federation role full-time. Mindy is our new, somebody's got their sound on still.
It's David.
Talking in the background.
There we go.
There we go. Mindy is our new Vice President for Finance and Administration. She'll be taking on most of the roles that Don was doing. And I don't know, Mindy, this is a group of largely other executive directors or CEOs of community organizations. There's some board leadership as well. They're all invited. We meet every other week. If you want to just introduce yourself quickly and say hi, and then we can, move on.
Sure. Hello, everyone. I am so excited to be here, to be filling these big shoes of Don Hannon and working with all of you. I've spent the last 17 years working in St. Louis nonprofit legacy organizations. So I'm very excited to be here and to work with all of you. And hi, David. I just transitioned from an engagement with David and was so excited to learn all of the things that he's doing here at in the community. So thanks.
All right. So let's let David jump in and do that conversation. And then I know that there are a couple of announcements or things we can certainly talk about after David presents his thoughts. You are still muted, David.
Of course I am. So hi, Mindy, and thanks, Brian. So Mindy, I thought maybe there was another Mindy Sharp. So nice to see you, and congratulations on your move over to the Federation. So there are a few things that are going on. Let's start with Medicaid expansion, because that's something that folks are trying to follow and figure out. So we got our court order this week from Judge Beadham, telling the governor's office that they have to move forward with enrolling people in Medicaid. We're still hearing some grumblings from some of the further right members of the Senate about fighting this. There really isn't a lot they can do to fight it at this point. We expect enrollment to open up here in the next week or so. Folks will be enrolling. I think this is an incredibly important opportunity, and similar to what we were doing with kind of the rental assistance information and some of the other information that we put forward, I think it's really helpful for you all to have the full information on how somebody can apply for Medicaid. You know, at this point, working adults up to 138% of poverty are going to be eligible to enroll in traditional Medicaid. That's going to include 275,000 Missourians potentially, and probably, 15,000, 10,000 people in the Jewish community, potentially 5,000 people in the Jewish community. And so I think there's a real opportunity there. The consensus is that this should cut the uninsured population of Missouri down by about 50% if people take the process up. So Miriam and others that are working directly, rabbis, congregations, this is going to be a huge lifeline to folks who need medical care and mental health care. They're going to have it paid for. And it'll also take some pressure off of our community to provide some of the services that will now be covered under the Medicaid program. It's probably not going to do a whole lot for seniors, because seniors are already covered up to a little over 90% of the federal poverty level. But there will be a group of seniors in that cusp area that will be covered. So for Nikki and for others that are working directly with seniors, this too may be quite a helpful thing to help them get in-home services and things to help them stay living independently in their own communities. And then for children, probably not a lot of take up for children. We already cover children up to 300% of the federal poverty level through the CHIPS program. So mostly this is going to be working adults, some seniors, some people with disabilities. So I think that's kind of exciting. I expect this thing to really come into its own here in the next 2 or 3 weeks while the governor's office gets ready to go with it. So that's issue number one. Issue number two is we're seeing more forward movement with the CRSA dollars. So there is no movement on the American Recovery Plan dollars yet, but there will be. coming in January. But all those HRSA dollars for childcare and for other programs are starting to become available to communities. Karen, I know we sent you over some stuff on the next go around from the Department of Elementary and Secondary Education on how to access these dollars. We're trying to get a handle on whether we can do kind of unified propositions and proposals for those dollars on behalf of all the different daycares that we work with, other in synagogues or within the J. So we'll be following that closely, and I expect that to evolve. But keep in mind, those dollars are going to be available for a very long time. So if we're not prepared to take advantage, or some of us aren't prepared to take advantage of them right now, I think there'll be lots more dollars available. We know, and then I'm going to speak a little bit to COVID. So right now we're starting to see Springfield's numbers come down just a little bit. Vaccination rates are going up, which is a very positive thing. It seems like the governor's office and others have finally jumped on the bandwagon with Governor Ivey from Alabama and a few other governors to say, hey, we got to get vaccinated. So that's going to have, we think, some promise. We do expect there to be some surging in St. Louis City and St. Louis County. That's coming. Whether we like it or not, that's definitely coming. And I think that's important. We unfortunately hit a pretty big milestone last week. Sorry about the ambient noise. We hit a milestone last week. The number of ICU beds being utilized with COVID patients is the highest it's been through the entire pandemic. That's obviously something that's very concerning to folks. This Delta variant continues to become something that is very difficult not to catch. And, but the folks that are vaccinated seem to be faring really well. Even the Israeli study that just came out suggests that, roughly 75 to 80% of the people that are presenting in hospitals with COVID are the unvaccinated. So it's still doing a fairly good job, and there's still no deaths. Actually, there's one death of somebody who was vaccinated. And so, vaccination seems to still be the key to this thing. We expect the emergency use permit to come off the Pfizer vaccine here in the next 2 to 4 weeks. And at that point, businesses are all kind of considering whether they're going to mandate and not mandate. I will tell you, I think we're seeing a movement now toward mandating vaccines from everything from universities to large businesses. And I think that is going to continue. That's going to become the norm as states begin fighting. And, we'll have states like Florida and others that fight back on that. But that's where we are. So those are the three main topics to cover, I think, for this morning. And I'm happy to take any questions about that. And that's from Missouri. From the federal level, we have an infrastructure package that looks like it's going to go. The House still has to pass it. It's roughly $1 trillion. Much of that money is recycled from the old COVID money that has not been utilized yet, but it's roughly $600 billion of new spending. It's going to be a huge package for the state of Missouri. We have, interesting fun fact for everybody on the call, we have more road miles per capita than any other state in the country by a factor of 1.5, and there's a whole bunch of reasons for that, not the least of which is that we were the beginning of the interstate system in the 50s. I-70 is actually the oldest interstate in the United States. And so out of $112 billion that is earmarked for highways and bridges, we're probably going to get 3 to 4 billion of that coming into the state, which is a massive influx of money. There'll be additional dollars available for everything from water projects. So Metropolitan Sewer District, for those that are in that area, you might be in for a lot of improvements and a lot of upgrades and probably quite a bit of construction here in the next 2 to 5 years. So I think that will come as a welcome to a lot of the developers and a lot of communities across the state. I think that this $3.5 trillion plan you saw, the budget blueprint voted on by the Senate here in tandem with or right after the infrastructure package passed. There's still some conversations around that. That actually looks very possibly like it's going to go. I think the House is going to have a hell of a time getting several of the key Democratic senators to go along with it at this point, but it looks like they're negotiating and trying to push it along as much as they can. I'm not even sure how to quantify that at this point. There's so much stuff in that bill that's going to trickle down. I think it's incredibly important. And so we'll probably see all of this stuff coming in pretty soon.
Hey, David, what is the plan? And is there a plan in place to be able to bring a workforce, to do the work that the funds are being allocated for? It would seem like there's not just people waiting around. So is there a plan to train people or to bring people? How does it work?
Well, that is definitely the perpetual conversation about workforce development in the state. We have a huge problem with that. Part of it is going to be wages. So we're probably going to be a hub for jobs because we're probably going to end up paying higher wages in a lot of surrounding states because we're going to have so much additional money coming into the state that state projects will probably inflate the wage base. And I think that'll be a pretty big plus at this point. And I think that's what they're relying on. But a lot of these jobs are going to be blue collar, some of them low tech, some of them medium tech jobs that are going to come in. And the cool thing about infrastructure, Joan, is that we'll probably have 10 years to spend that money. And so that gives you a lot of runway to bring in the people you need and keep training those folks. There is still a problem with people coming back to the workforce. Missouri is sitting at an unemployment rate of about 5.7, 5.8%, a little under the national average. And there's obviously a lot of people that are sitting and are not included in that unemployment rate that just stop looking for work. And I think a lot of those folks come back in a really healthy, robust economy. We're starting to see wages rise, which a lot of folks believe is the key to bringing people into the workforce at this point. But there is an emphasis on community college training. There is an emphasis on VOTEC, and that might lead into some of this stuff. But the real answer to your question is no, there's no real plan on that. Just everything else that's been going on around it.
Other questions and thoughts? David, you shared some data about the infection rates and breakthroughs and stuff. How up to date is that and where are you getting it from, just so that we understand? That is off the Department of Health and Senior Services dashboard, and that is as of, I think, this morning or yesterday. So that's government data. And unless you're my son and you have no trust in government data, a lot of people on this call probably trust most of the data that's coming out. Anything else for David? I do want to make one plea to everybody on this call. There are so many new programs and additional dollars that are floating around, from Medicaid to unemployment to other issues. We do such an amazing job in the community providing services to people. And one of the great things about our community is we give service and ask for money later and figure it out later. But I want to encourage you all to really spend a little bit of time or deploy some staff in understanding what those program eligibility limits are and doing as much as possible to capture as much of that governmental funding that you can, because that's what it's for. It's for you. It's for your constituents, whether that's rental assistance or Medicaid or mental health services. And that will allow you to free up your dollars to do all the additional things that you do to increase the quality of life for people.
David, I did have one question. You had mentioned that some of the bigger retailers or bigger companies are now requiring that their employees be vaccinated. And I just got an email from my synagogue about for high holiday services that they're requiring vaccine cards to go to the service. I'd just like you to touch on that and what that means for the other organizations that have not taken those steps yet.
Yeah, Jen, I'll just say, we at Federation have said that you have to be vaccinated to come into our building, including staff moving forward. So we're on that same train. Yeah, so there's multiple ways that folks are deploying this kind of work. One is for businesses to say, if you want to work in the office, you have to be vaccinated. You have to show proof of vaccination. Otherwise, we'll make accommodations for you to work virtually. Some businesses are just flat out saying, you got to be vaccinated, especially healthcare entities. And I think we're going to see more and more of that. There are private venues, and I just heard about a concert promoter now saying that
They are not, and it's a country, interesting enough, it's country music. They are not going to permit people to enter into the venue without showing their vaccine card, and put in, like, mirroring it up with an identification. And then we've got venues like Lollapalooza that have said, hey, we want everybody to show their vaccine card as a kind of a point of pride. And so there are different ways to do this. And I think you're going to see like all the above approach. But thus far, private organizations have the ability to make their own decisions about how they want to move forward. I would encourage you, I'm not a lawyer, so I have no business giving you legal advice. The one thing I would encourage you to do is be very consistent. You know, whatever your policy is, it should be clear and unambiguous. It should be posted and it should be applied consistently. And that's where folks get really caught up, is when, you know, somebody says, oh, but my brother came yesterday and didn't have to wear a mask or whatever it is. You know, that's where you end up getting into problems. But as long as you're consistent, you're going to have the occasional altercation with somebody, but for the most part, people are being fairly respectful. Did that answer, Jen? I probably didn't do a very good job answering your question.
Will you maybe tack on, David, a little bit? When the vaccine comes off of emergency status, is there any thought that that will change anything out there about how it's being dealt with?
You know, there's two sides on that. One is the take-up rate for vaccinations. There is a small group of people in theory that are waiting for that before they get their vaccination. But most of the folks that seem to be thinking through this don't really believe that's a very significant group of people. You know, it's, for many, it's just an excuse. It's just a talking point. It does change the calculus for a lot of businesses to go back, because emergency use technically is kind of a trial or, you know, an approval with an asterisk next to it, even though emergency use is actually about 95% of the way there for the full FDA approval. So, Brian, I think the theory is once emergency use comes off and it's approved just as a normal vaccine, it makes it a lot easier for businesses that are on the fence and for venues that are on the fence to say, now we're going to require this thing. I expect travel. I mean, we're going to see a lot of travel venues requiring vaccination cards and testing, by the way. Stanford just issued their directive to their students coming back in the fall. Every student has to be vaccinated, and they have to get, and there's some exceptions that, and they have to be tested every week. So, you know,
I had been speaking to some donors who own companies in town, and a lot of them were saying, once it stops being on that emergency usage, we're going to insist on it, and had heard that public schools can't insist on it when it's in the emergency category, but like other traditional vaccines, can if it's one of the standards. And so that might adjust some things, but I didn't know. That's why I was asking.
Yeah, I'm not sure that I buy the public school conversation about it, because an emergency use authorization is absolutely an authorization. I think that has a lot more to do with that institution receiving public funds. So if you're in Florida and you receive public funds, in theory, the state has some levers over you to force you to or not to do something. The state also has the power of statute, so they could pass a statute that prohibited any political subdivision for doing some of these kinds of things. And it's very tricky with schools because, you know, under 12 is not approved. So, you know, there's a lot of those pieces. Somebody asked a question about Moderna. It looks like Moderna is about 30 to 45 days behind in their request process from Pfizer. So we would expect Pfizer to get theirs, and then several weeks later, Moderna to get theirs. And J&J, I don't think has actually requested their permanent status, but I'm not positive about that.
Other questions for David, or if people want to continue talking about COVID? Jen, I heard you say, I'm assuming that you're B'nai Emunah. I saw an email from B'nai Emunah that,
Yeah,
right, in order, and Anita can talk about this, but basically in order to step into the building, you have to be vaccinated. So if you're under 12, you can't really step in. And if you're over 12, you need to have a vaccine to step in, and they'll be doing outdoor services. Is that fair, Anita?
For right now, that's for High Holy Day
Right. Sorry, that's what I meant.
services and activities.
We're the same.
Rosalie, what? I'm sorry.
I said we're the same. All children's services are outside and everyone has to provide their upload their vaccination card to attend an in-person in this.
The Shulamita has a question about a third vaccine for seniors as a booster. That does appear to be coming. There's a lot more discussion about that, and the results that are now coming out of Israel relating to kind of the waning of both Pfizer and Moderna after a 6-month period in terms of its protection. Now, the one thing that's really, really clear is that these vaccines, even beyond 6 months, are giving people a lot of protection from the worst elements of the illness. So it is not going to be unusual for somebody who's vaccinated to get sick with COVID, but it is going to be highly unusual for that person to have symptoms that drive them to a hospital. And so I do think that's coming. In fact, Israel just approved that third dose, I think, for seniors, anybody over 60 maybe, which doesn't feel like being a senior at this point. So, but I do expect us to follow suit. In fact, I expect folks just to go to Walgreens and say, oh yeah, I haven't been vaccinated, let me have it. I mean, we're kind of on the honor system to some extent. So I would expect a flood of individuals going and getting a third dose, especially people that got the Johnson & Johnson vaccine first.
So we are seeing a lot of breakthrough infections, and we have seen some pretty severe illness and death. And I don't think that the death that I'm aware of is probably the death that's on that Department of Health and Senior Service information. So my guess is there's some underreporting of that.
That wouldn't be a surprise, Joan, to have some, although it will catch up. So that reporting usually lags in general by a couple of months. So it will ultimately catch up. But what is really, really clear, even for people over 60, the severity of the illness as a general rule is way, way less than the average severity of the illness if you don't have a vaccine. I mean, this Delta strain, if you don't have a vaccine, this Delta strain is nasty, and it's nasty for people at almost all ages. And it's tearing through folks. If you
I do think also that our folks got vaccinated really early, and so we may be sort of at that tail end of the higher level of immunity.
I think that's right. And what we're also seeing is there are a ton of folks walking around with Delta who are vaccinated that have zero symptoms. And they're not, I mean, nobody that's vaccinated is getting tested. Even if you were exposed, you're generally not getting tested for it because you don't have any symptoms. You don't feel bad. You assume you were protected, right? And so there's this conversation around perfect vaccines versus non-perfect vaccines. You know, you just got to think of it not as a bulletproof vest, but just as some protective layer over you that's going to help stop things.
There was another question that just came up. Paul's asking essentially the same as Shulamit, about a third. Yeah.
Yeah, I think those will be treated similarly. Whenever you hear the FDA or the CDC talk, they talk about people with compromised systems as well as people over the age of 60. That's generally kind of the group that they're looking out for. The other thing to keep in mind is the research now that's starting to come through is that, you know, typical masks, like the cloth masks that people were wearing, they're not very effective against this strain. They're only about 30 or 40% effective. The ones, if you really want to protect yourself, you wear a KN95 mask. That's how to protect yourself. Properly. You wear it properly, by the way. We see a lot of people with the mask like right underneath their lip here, and that's not doing much.
Sorry, I'm just telling my wife that we need to order more KN95 masks. Anyone else? Questions for David, or want to continue a conversation just about COVID related stuff or anything else?
I'm gonna try the nap.
Okay. So I want to pivot for a second since we've been talking about political related stuff. Karen, will you share our meeting this week?
Sure. Thanks to JCRC, Rory's relationship with Congresswoman Bush's chief of staff, we were able to get an in-person meeting with him. His name is Abbas Alaway, and her community liaison, communications liaison, Asia, and I'm forgetting her last name. So it was Rory, it was JCRC, American Jewish Committee, so Nancy Lisker was there, and NCJW with Jen Bernstein being there, and Brian and myself. And we had about a 45-minute, really a relationship building conversation with her chief of staff and her communications liaison, just to share out about our Jewish community, the diversity of our community, the issues that we have in common that we are working on, hearing more about Congresswoman Bush's, the way she works and the way she approaches her work from a place of wanting to help, and they really kind of laid out kind of her MO basically. But it was really a wonderful opportunity for them to get to know our Jewish community, the history of our Jewish community here in St. Louis, the history of our institutions, and how we work together, and how we want to be in partnership with her. A number of us obviously in the Jewish community are in her district, but also just say we want to open the lines of communication. And so I thought it was a really positive first meeting with her staff, and we look forward to continuing our conversations and engaging with her and her staff, so that they really understand the work that we do, and we are there to understand the work that she's doing as well. Brian, I don't know if you have anything you want to add, or Ellen, if you have heard from Jen and want to share out what she shared.
I just want to add, there was an article in Jewish Insider about that meeting called The Room Where It Happened. St. Louis Jewish Leaders Meet with Representative Cori Bush Staffers. And it's a really nicely done article with some quotes from some of the folks that were in that meeting. It came out last night. And so that's a good thing. I mean, but you're right, Karen, it's all about relationship building.
And Hershey, to answer your question, while it was, Hershey asked, right, was anything outside of Missouri discussed, i.e. Israel? At the end, literally as we were walking out, there was a brief statement about how we understand that we may not see eye to eye on everything, but use our community as a resource to ask questions, to learn, and those kinds of things. But as Karen said, this was a relationship building meeting. So the whole idea was to focus on the things that we do agree on. And at the end of the day, we agree on a lot of things around, getting people back to work, around helping the most vulnerable, around, a lot of different things. So this wasn't the time or the place to really focus on what divides us, because that's not how you build a long-term relationship. You start with where you can meet in the middle, and then hope to have some influence over the other things, and become a trusted partner and a voice that they trust. So we didn't really get into that on purpose. Any other we wanted to make sure you guys knew that there's a lot of stuff that you guys see around the Congresswoman, and people have been asking for quite a while, are we sitting down with her? Are we sitting down with her? And I would say we've been working for quite a while behind the scenes to build a relationship so that we could sit down with her. And those of you who know how these things work, it's often her chief of staff, first of all, her community communications person is kind of the gatekeeper for appointments and whenever she's actually in the district. So developing that relationship is important. And the chief of staff manages and controls a lot of different things. At the end of the day, these individuals are extraordinarily busy and rely on their staff to vet them, but make sure that they agree with their positions and understand where they're coming from. But then they're the people who do all the research, read all the things, put together the talking points. So we met with two very key people, not with the Congresswoman herself, which we talked about doing in the fall, but with people who help to set her agenda, both time-wise and her areas of focus and how she responds. So. Well, happy to answer any other questions, but this is part of continuing to develop a relationship. And it's obviously an important one. We have some things that we'd like to really influence her on, but we can't come in there and start with that.
We did make it clear, though, that we are a good resource. So as she is, working with other communities, that the St. Louis Jewish Federation and JCRC and all of our organizations are a good resource around information that she might want to gain around Israel or other issues, anti-Semitism, those kinds of issues.
Okay, anything else? Anything else around, sorry, the Congresswoman, or anything that David said that people thought about and thought, I should have asked? All right, let's open it up. Does anybody have anything that they wanted to share or talk about or bring up? Mindy? Mindy
Hi.
EE, yeah.
Good morning, everyone. So I want to thank so many of you for completing the survey for the COVID needs assessment. This is our third one. So many of you responded. Really, we're getting great information about ongoing organizational challenges that you're all facing, challenges that your constituents and members are facing, some positive outlooks. We're working on analyzing all that information now. But one of the things that we heard from that was about organization capacity. We've also been having lots of conversations with you. We did that survey pre-COVID on capacity building and organization capacity in our community. So this is a common theme that we're hearing and really trying to figure out ways that we as Federation can support you all. Mentioned this to a community member and she shared a resource that I was not familiar with. So I wanted to let you all know in case you were eligible. The Spirit of St. Louis Women's Fund is opening up a letter of inquiry process September 1st. So this is for grants $5,000 to $25,000 awarded to nonprofits for project or program support and capacity building. There are some eligibility requirements, including the operating budget has to be less than $1.5 million. It's not specific, I know, so I see a lot of you, that doesn't apply to you. For those that it does apply to, I'll put the link in the chat. It's not specific for women. There are some focus areas, art and culture, education, environment, health, and social services. So I'll share that link, but it was a resource I was not familiar with and wanted to be sure to pass it on in case it was applicable to any of you. So thanks.
Anyone else? I am getting the link to the article that was just mentioned, and I wanted to put it in. It's in the daily for the Jewish Insider. It's in the daily update. It's the first article listed, and I'll put the link in the chat. Although, oh yeah, okay. Anybody else? Anything anybody wants to bring up or talk about? How's everybody doing? I know we've talked about this. There are a couple of staff from the Federation on here, but we thought we were opening up and now it seems like we're locking down a little more. And I know it seems to have taken a little bit of a toll mentally and emotionally on our staff. How are others doing and feeling about things?
We're getting mixed reviews. Some of our volunteers are saying virtual only. Some still want to come in, but want to, social distance and wear masks when they're in the building. So we're seeing a lot of mixed stuff. I anticipate if we're going to get the surge that David talked about here, that probably by September, we'll be back to all virtual for a couple of months. We'll just wait and see. I mean, this is really hard to manage because we need to be really flexible in terms of how we manage our staffs and our volunteers to meet their needs and ours at the same time. So it's going to be interesting to watch. Let's just leave it at that.
Hershey says it's a mess and less clear than last fall. Hershey, is that because kind of like the yo-yoing? Like, is it this? Is it that?
Yes. We were under the impression that we're going back to quote unquote normal, and now we're not. And the holidays are super early this year, and the students are coming back super early this year. And we've got a bunch of campuses, each one with its own slightly different and not necessarily consistent policies. And If there are people from the community who want to attend, that adds another layer of complication. And so essentially I thought I didn't have to take notes last year for future pandemics, and it would be the oddball and the exception. And I'm very saddened and frustrated. And thank you for listening. You're cheaper than therapy. That whatever we did last year is sadly relevant again this fall. I was not hoping, no one was hoping for it to be this way. And I'm on that boat with everybody too.
Yeah.
Yeah,
I
I
agree
would
with
say, I mean, I'm in a similar boat, not with students to Rabbi Hershey, but I think we're seeing among our constituents and so on, like, it's not that they're fighting back against what we do, but as opposed to last year where we were just beginning to open at this point, so everyone was kind of like, okay, we're all one team, we're all doing, now there's so many different views on what's the right way to proceed, and every discussion becomes a bit more heavy, and we keep revising and revising. It's a struggle. It's a struggle right now, I would say, yeah.
Rosalie, you were going to say something before.
So we've been back since June, and now we have put to our staff that everyone must be fully vaccinated by September 1. So unfortunately, not all staff is choosing that. So it is what it is, unfortunately. But and as far as, I mean, we're just planning and then having a secondary plan. Like our gala is at the end of September during Sukkot, and we are planning in person. We have a huge tent out in the parking lot, and yet we still offer a virtual option. So I think it's just a couple of options and go for it. So that's where we are.
Anyone else?
I have a
Miriam.
specific question that perhaps David and Nikki and Joan, we had just started back with in-person visits to older adults who live in a variety of different types of residences, from assisted living to skilled nursing. And when the Delta, about 2 weeks ago, we stopped it, about 2 weeks after we started it, but we're getting lots of requests from the professionals at those residents to please, please, please come. Our staff are all vaccinated. It's our clergy, actually, our chaplains. So our 3 chaplains are vaccinated, and they're visiting people who are vaccinated. And yet, because of the potential for spread and because of the deaths I've been hearing about also, Joan, not at Covenant, but elsewhere, I just didn't want us to be the ones to be bringing it that day. Do you have thoughts about that? Because they're begging us to come because of the emotional support and the spiritual support that they need. I'm torn because we want to provide it. Everybody's vaccinated and it still feels risky.
Just a couple thoughts, Miriam. One is that we have safe places that people could meet. We have a conference room with some plexiglass. So even if it's not going into somebody's apartment, that's a possibility with some of the common spaces. Since we can't keep track of residents who hasn't a vaccine and who hasn't, then it's really on the chaplain or whoever to decide if that's somebody that they want to see. But we also have a lot, even though it's hot, we've put a lot more umbrellas and things outside. So I would suggest that. So I think that, if there's any way that it can be structured to be seen, that would be helpful. We, of course, don't check everybody who's coming into our building, nor do we check people's guests. So, anybody could be coming in and it's really sort of every resident themselves has to make those kinds of decisions. We did open the cafe a little bit. So that's a place that residents can sit and people from the outside that are vaccinated. That's for the community people. So I think here and, meeting in a public space or something that's safe, if it's possible, can make a huge difference mentally.
I was going to also add, Miriam, that you could be proactive and do COVID testing proactively for those individuals that would be meeting with older adults. Because as David had said earlier, even if you're vaccinated, you could be carrying COVID without having any symptoms. And that we've seen quite a bit of that, of the double vaccinated people that are carriers, but they would never known it. So by proactively doing COVID testing, you've then done that double assurance that they don't have COVID. And if you did that periodically, I mean, you'd have to probably do it weekly because the progression of the disease, but that's another way you could probably meet that goal.
Yeah, I think Jen's right. And I mean, the other way you can do it is have the chaplain wear an N95 mask. I mean, look, the N95 is pretty clear that it works. And so, you know, I would say, like, if the chaplain is willing to take the normal precautions, I think Jen's absolutely right. Getting a saliva test done once a week and then wearing an N95 mask. I mean, we could set you up with somebody from BJC on the COVID expert to figure out whether or not that makes a lot of sense. But I'm guessing, based on everything that's out there, you can be very prophylactic and protect on this. Especially, like, and to Nikki's point, you know, if people are willing to go outside and they keep distance and all that stuff, I would guess that'll work really well, you know. But like, people that are just walking around with a cloth mask on, they're not really doing a whole ton. And so if they're willing to, like, take those precautions, it seems like a pretty reasonable thing to do. But again, we could set you up with somebody that would be able to tell you conclusively, yes, we think the evidence suggests these people are safe if you do that.
This was really helpful. It stopped the day I heard from somebody who was shadowing one of my senior services team. We have this tenant who took their mask off because the person couldn't hear them or see their mouth. They got close. I would have done the same thing. So I understand it. That's when I stopped. But I love the idea of testing. And the chaplains, I believe, will keep their masks on and keep their distance, even if they're struggling with communication.
Yeah, and Hershey just sent a note, and I think he's absolutely right. I mean, all this stuff is, like, evolving in terms of what works and what doesn't work. And so, you know, WashU and BJC have a great conduit for information, and I know some of the other hospitals do as well. I would track those.
Do we have a source for N95 masks? I know at one point we couldn't get that stuff and we got all kinds of other things.
I don't think there's a shortage of N95s right now.
There's not anymore? Okay.
I don't think so either. I
Okay.
texted my wife while we were talking and she just ordered a bunch, but I don't know about mass quantities. Scott, we had some resources and stuff previously. If people are having problems, do we still have those?
We do. We do not have significant numbers, but we do have an inventory of the KN95 mask, and we could assist organizations in some capacity.
All right. It was in the chat in case people missed it. Sababa is being postponed by a year because of COVID and what's going on, and the fact that it's a family event. And so you're going to have a lot of kids under 12 who are unvaccinated, and it just didn't feel like the safe and secure thing to do at this time. So that's been postponed. Did anything else come up in the chat, or does anybody else want to talk about? Yeah. Any other subjects or, yeah, Marion.
Just a comment based on the frustration we heard a few minutes ago. You know, I think we're all feeling that frustration. We had taken 3 steps forward and now we've gone 2 steps backwards. I had about a month or 2 ago, when things were on the upswing, I had designed a banner to put in our lobby for the high holidays, you know, welcome home, blah, 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 that kind of thing. And I'm not going to do it now because we're back to looking at the small stalwart group of congregants who are willing to come again this year for the high holidays. So I'm just praying that, you know, that banner is on hold and that next year, God willing, we'll be able to put it out and things will be better. And, you know, I always said that one of the main functions of our jobs is to be the cheerleader. And it's hard to do that all the time, especially when the going gets rough, but I'm grateful for the support groups such as this one and the other groups that I'm involved with. And, you know, we just have to band together and support each other and support our constituents and keep on cheerleading and praying for the best.
Yeah, I appreciate Marion that, and as Hershey said too, this is a place where I hope that we can talk to each other and share frustrations, as Hershey said, but also maybe get some support and ideas and assistance. But I said this last year around this time as well. We're responsible for leading our organizations, whether you're professional or volunteer, and we have to have the space and the time to take care of ourselves. And sometimes just naming these things and talking about them for a couple minutes can help, but there are resources that are available in the community to support each of you and your organizations. And Miriam and her staff are there to help either themselves or to help find and refer out to resources as well. You guys may have others, but no one should ever feel like they're on their own and there's nowhere to turn or get some help, even if that just means talking it through with others. And I'd also offer, if this is something that really is becoming an issue, that we can certainly set up and have a time for us just as professionals to be able to just have a check-in regularly about this specifically, if that would work as well. So that's the social worker in me. Anyone else?
Actually, what I want to add to that, by the way, is, and it's not to the level that Brian's talking about sport-wise, but it's come to my attention recently, there are members of the lay community that don't know about these calls. And so I would ask all of you to make sure everyone you know, whether they're involved at your organization or other, if you know that so-and-so is a board chair somewhere, just ask them if they know about this call, because even for the lay leaders, I think it's a valuable, you know, I think Paul would attest, right? It's a good thing this call is a good thing. And if they don't know about it, they can't seek it out to try to get something from it. So I'd ask that you, whenever it's appropriate, make sure that everyone you know who might be interested in being part of this call, I'd ask you to share that with them, and we can get them the invite if they haven't seen it or if it went to spam.
Yeah, I just added in the chat that AJC National has continues to have all their regional offices, 24 offices closed, and have staff working from home. We here in St. Louis have no in-person events or meetings planned for the rest of the year.
Thanks, Paul. Anyone else on this? Or does anything, everybody, it doesn't have to be as heavy as this. If anybody has anything they want to share or talk about, please feel free, because I think we're going to be on a little bit of a funky schedule moving forward. I'm actually looking at my calendar. We have a call set for 2 weeks from now. After that, we might fall right in between the holidays, the 9th and the 23rd. Actually, amazingly, for whatever reason, all of our calls still do stand, even with the holidays, given the every other week nature and when holidays actually fall. So we'll certainly have the opportunity to continue to talk. I would imagine that calls might be a little smaller during that time period, as some people have other things to focus on, but we will certainly, as long as there's not a holiday, be available and meet for as little or as much as we need to each time. And I'm gonna do last call. Anybody have anything they want to touch base on? Thank you guys all for everything that you're doing. It's a hard conversation because it's a hard situation that we're in, and we're trying to lead. And I appreciate what you guys are all doing, and would just say, if anybody ever feels the need to talk and it feels like I'm the person that you want to talk to, please don't hesitate to reach out.
Awesome. Well, great seeing everybody. Good early Shabbos. Have a great weekend. And tell your board chairs they can call me if they want to talk. So anytime.